Welcome to Cracking the Perimenopause Paradox, from brain fog to clarity, presented by Dr. Diana Hoppe. And that's me. I'm Dr. Diana Hoppe. And who am I? I'm actually a board-certified OB/GYN with over 30 years of experience. I'm a hormone and weight loss expert. I'm also an award-winning author, and I am an expert specifically in perimenopause and menopause. Some of the places I've been seen and featured on, you can see here. So I try to get through different resources so I can get to all you women and men through different avenues. So this is what I've been seen on. And then I have lots of Google reviews. I think we're at like 70 now of Google reviews that are 5-star. So it's pretty cool. And this is one of my quotes. If you've been forgetting words mid-sentence or waking up at 3 a.m., maybe drenched in sweat, or wondering if you're losing your mind, well, you're in the right place. So welcome to the Perimenopause Paradox. Now, which of these symptoms bothers you the most right now? Is it brain fog, fatigue, mood swings, or is it weight gain? So think about which one is bothering you the most right now. But in perimenopause, this is when many of these symptoms can occur. It's the stage where a woman often is at the peak of her life, right? She's feeling good. Her kids are growing up. They're going to school. Maybe her job is doing great, but it feels like your body is betraying you, right? Well, this is why it's a paradox, because women in the late 30s and early 40s often have the most life wisdom and confidence. They're at the height of their career or creativity, but they're experiencing brain fog, fatigue, mood swings, maybe depression, and definitely weight changes. So, what are the key symptoms of this perimenopause paradox? Well, it's brain fog, memory lapses, mood swings, anxiety, feeling kind of off for no reason, fatigue, hot flashes, night sweats, unwanted weight gain, like why all of a sudden do you have this muffin top? Lower libido. Your libido has just gone to nothing, right? It's non existent anymore. And then disrupted sleep, waking up at 3 o'clock, not being able to fall back asleep. Very, very common symptoms that you might be having. Well, let's define what is myth and what is fact. So the myth is it's just in your head. When the absolute truth is, the fact is, it's your hormones. Nothing can be done. Absolutely not true. There's lots that can be done. It's the same for everyone. No, every person's journey is unique. You are unique, and we can find a way to help you get through this time of your life, because there's no reason why you can't be enjoying it right now. So let's first define what is perimenopause versus what is menopause. This is a very common question I get. You might be asking, well, am I in perimenopause? Am I in menopause? So perimenopause is the 2 to 8 years prior to menopause. So menopause is when you have a whole year without any menstrual cycles. So that's 12 months with no periods. And this pretty much marks the 1 year point with no cycles, which equals menopause. The average age in the United States is 51 years of age. Prior to this time is perimenopause. And this is the natural transition every woman will go through if she lives to about the age of 51 or 52. So every woman is going to experience this transition from perimenopause to menopause. And perimenopause is the 2 to 8 years before, and it's the main symptom is irregular menstrual cycles. So that's the first symptoms, but you can have lots of other symptoms just like we just talked about. So let's clarify for you, what is the menstrual cycle? Because it really doesn't get much talk, even in elementary school, high school, beyond, right? A lot of women ask me, well, what exactly is my menstrual cycle and what are these different phases, right? So we break down the menstrual cycle into 28 days. So the first phase is what we call the menstrual phase, which is day 1 to 5. And day 1 is the first day of your bleeding or your period. Phase two is day 1 to 14. This is called the follicular phase. And that's because in the ovary, you have little follicles. And those little follicles are trying to become an egg that gets ovulated. Well, your ovary is making hormones, is making estrogen, and then eventually one follicle gets determined to be the dominant follicle, and that's the one that gets ovulated, which happens in phase 3, which is ovulation. And this is approximately day 14 of your cycle. The next phase is luteal phase, and that's day 15 to 28. So that's the different phases: menstrual, follicular, ovulation, and then the luteal phase. So when someone brings up these terms, you'll be able to better understand what they mean. And this is a 28-day cycle, but not every woman has a 28-day cycle. Yours might be 30 or 32 or 26, and this can also vary as you get further closer to menopause within those years of perimenopause. So that clarifies the menstrual cycle. So now let's talk about the menstrual cycle and then put it over to perimenopause and what's happening to a woman or to you right now when you're going through perimenopause. We just talked about the phases, the follicular phase, ovulation, etc. So on the left, you can see the 28-day cycle. So we know that estrogen is being produced the first part of the month, or the follicular phase. It peaks at ovulation, which is about day 14 of the cycle. And then you can see it also kind of peaks around day 21. Well, after ovulation, this is when progesterone starts being made, and it peaks about day 21 of the cycle. If you look at testosterone, you can see that peaks pretty much at ovulation, which is Mother Nature saying, let's rev up that libido so that you can get pregnant, so that the sperm can meet the egg, gets fertilized, and you get pregnant. So that's the whole menstrual cycle kind of in a nutshell. So now let's move to the right, where you see hormone levels over a woman's lifespan. So you can see the reproductive years, that again is 20, well, age, the teens really, to even through perimenopause. You're going to still be in the reproductive range. It's just your cycles are not as regular. So you can see estrogen in the pink. So you can see it's pretty cyclical. And the progesterone, they're pretty much stable, the same height, the same frequency. So it's pretty, what we call stable. 28-day cycles, things are regular, boom, you're on target. Now go to perimenopause. Your cycles start getting really erratic. So you can see how the pink line, the estradiol or estrogen, goes really wacky. It's almost like a roller coaster, right? And then you have much less progesterone being made. And that's why it's called estrogen dominance, because you're not ovulating each month. So your body, your ovaries aren't producing the same amount of progesterone. So you might feel more cranky, irritable, anxious, those kind of symptoms, the sleep problems. And then you can see with menopause, this is when the ovary runs out of eggs, and that's 12 months with no cycle. So you can see how the estrogen plummets as well as the progesterone. So you wonder why you're having these symptoms. Well, it's because these hormones are pretty much in a storm, in a roller coaster, if you will. All right, so this shows you in the next here how the hormones change over time. So we show how that progesterone in the teal really plummets from age 45 to 50. You can see that steep decline, as well as with the estrogen. And then you also can see the testosterone. But the main thing is that the hormones really, if you look at age 51, see how the pink line's really low, as well as the progesterone line, the teal line. So that is late perimenopause, almost into menopause. And that's why you're having those symptoms that we talked about in the very beginning that you might be experiencing. And this impacts your brain, your metabolism, your mood, and your sleep. So what is the perimenopause paradox, the pillars? What are the 3 pillars? Well, when we put science, mindset, lifestyle changes, they align, and clarity will return, your confidence will rise. And then you step into your next chapter knowing what's happening to your body. A lot of women don't know what's happening to their body during this time. They feel like, all of a sudden my body's changing and I didn't do anything different, right? Well, your hormones are changing. So we first have to understand the biology, your biology behind what's happening with the hormones. Then we need to rebuild your foundation. So we need to talk about lifestyle changes, ways that we can help with the hormone fluctuations, things we can do to make your life better and feel more clear. And then we can reclaim your power. That's the third pillar, which is a mindset shift. So I'd like to now kind of give you some examples of some patients, and you might be able to relate to one of these three examples. So we're first going to meet Cheryl. Cheryl's 43. She's a mother of 3 kids. She's a homemaker. Her cycles are a little bit irregular every 25 to 32 days, but she's noticing she's getting really irritable with her children. She used to be kind of smiling and working with her homework and stuff, but now she's has very little patience, and she's screaming at her children, saying like, "Who is this woman?" Right? She can't focus. She has difficulty with household duties like managing the checking account and the bills. And also her libido has gone to nothing. Is non-existent. And now it's causing some problems in her marriage because her husband's like, "What happened to you? You used to be like into sex and now you don't even want me close to you," right? Very common symptom. So what we did first for Cheryl is I first did a full consultation with her. I got a full medical history, surgical history, family history, and this is what I do with each patient. So if I saw you as a patient, I would get your full history, get an idea of what's happening with what we call the wheel of life. What's happening in your home, what's happening with your business or your career, finances, your overall health, family, friends, romance, and then personal growth, and then also fun and recreation. So these are all important kind of pieces of the pie that we like to look into to see what is your life like and how do we want to make it better. Then I have my perimenopause symptom tracker, which really goes into the physical and emotional symptoms that are happening during the month for you. So I give this tracker sheet out. It's a great, useful tool to see when are your symptoms the worst? Is it mostly during the luteal phase? Is it all month long? Etc. So I love this sheet. So I gave it to Cheryl to do. And what we found with her is that she had really bad symptoms right before her period. So her period are these marks of X here. This is her menses, or cycle, menstrual cycle. 5 days, and you can see here it's from day 27, 28 onward for 5 days. Now, this kind of tangerine color, this is the symptoms when she's having really bad PMS symptoms, feeling down, feeling irritable, yelling at her kids. Her brain feels like it's completely foggy. So you can see here that her symptoms are worse about 7 to 10 days before her cycle. So we first explained to her about what is the physiology, what's happening with your hormones, like we talked about with the menstrual cycle, what's happening with the estrogen and the progesterone, and what's happening during the period. So what we did for Cheryl is we educated her, right? We talked about the hormonal shifts and what's happening during each month. We also started a progesterone cream, which is something I use a lot for perimenopausal women who are having problems with night sweats, irritability, feeling just really off. And I kind of cycle this during the luteal phase. And you now know what luteal phase means, right? Day 15 to 28 or 14 to 28, if you add ovulation to that. And we also added some vaginal estrogen cream. I mentioned how her libido was really nothing, non-existent. Well, partly it was because she started having vaginal dryness. Now, when you have vaginal dryness, you really don't want to have sex because it hurts, right? And if the sex hurts, you probably want to avoid it. So if we get you a little estrogen cream that's used twice a week, that's going to really help those vaginal tissues, get rid of that vaginal dryness, make life a lot easier for everyone, for you and your husband or your partner, right? The other thing I talked to Cheryl about was supplements, because we noticed that her vitamin B was low, her B12, her vitamin D as in David was low. She wasn't taking omegas, and all of these supplements on my site, Amazing Over 40, really work to synergize to make your body optimal. So you have the omegas for your brain, the vitamin D for your bone and your immune system, the Mida support for just a basic great multivitamin, methylated B complex to help with clarity and energy, and then there's also a probiotic. So I went over this with Cheryl. She started those and she started feeling much better. And then I also gave her some lifestyle tips, some self-care tips, which everyone can use. You can use this. You can tell your friends, your neighbors, your family, but tips to really help with sleep hygiene. And there's a lot of things to do to keep the room more cool, like 68 degrees, not in the 70s, but you want to keep on the cooler side. Limit processed foods. Also, don't eat that late at night because that's harder to sleep. Also, limit alcohol consumption if possible because that can also affect your REM sleep. And then some mental wellness techniques like cognitive exercises, like doing crossword puzzles or any way. There's other things like you can play different games, different apps that really keep your brain shifting and thinking about numbers or words and things that you can stay sharp. And mindfulness practices. This is key. This is taking time to breathe. This is taking time to see what you're doing and really being present with what you're doing. So if you're doing the dishes, do the dishes. Don't be thinking about the soccer practice that needs to be done or what you need to make for the kids for school. It's doing the dishes. Like really get into feeling the water, the soap, doing the dishes. If you're taking a walk in nature, really look around, breathe, look at the trees, literally smell the roses if there's some roses. So that's a mindfulness practice. And then exercise and stretching, very important. Our joints start getting a little tighter, a little more stiff, and we need to stretch and also have weight bearing exercise to keep our muscle mass. So that's what we did for Sharon. Now let's move on to my next patient. This is Sharon. And she was a VP of a marketing company, and she was really having bad brain fog. I mean, to the point where she thought she might lose her job. She was very high powered in a marketing company. She was having memory lapses, like in meetings, mid sentence. She'd forget what the topic was. Really not good when you're in a male dominated field. She was starting to get depressed. She was not getting any help from any of her doctors. She had poor body image because she was gaining weight. She had tried non-hormonal supplements, no benefit. And she came to me pretty much hopeless, saying, please, please help me because I don't know what else to do. And she did do a video after she saw me, and she was crying because she says, finally, someone is listening to me and taking my concerns into account, like really believing that I'm having some problems. Because a lot of times the doctors will say, oh, it's nothing, just take an antidepressant or to have a glass of wine or, just get through it, just deal with it, right? Or eat less, which is not helpful when you're actually not eating much and you're trying to exercise, right? Are you with me? I think you can. All right, so let's talk about brain fog because this was her main concern. And this is Sharon was having forgetfulness, missing meetings, forgetting tasks. She couldn't multitask as much as she used to. She couldn't find the words, like it starts with T and has two syllables, but she couldn't get that word. And then also losing train of thought, like mid sentence. So she'd be at a presentation at one of her marketing programs and she would just forget mid sentence what she was saying, which really doesn't bode well for your career. Because a lot of men may not understand what's happening to a female cohort during this time. And these were only magnified by pressure and fatigue. So she was getting more stressed because she thought she could lose her job, financial worries. She was completely fatigued because she wasn't getting good sleep, which also causes brain fog, right? So these are only magnified in the workplace. So you can see women in the workplace, they consider reducing their workload, considering finding a new job or changing their job, maybe having less roles, maybe less professional roles, maybe some more administrative or less responsible tasks. And then about 48% had stated they had negative impact on overall job satisfaction and motivation, and that they also had less confidence and self-esteem. So these are very major things that can happen to women who are in high career positions. Not in addition to those that are homemakers or part-time workers, this happens to women in lots of different workplaces. For Sharon, her main concern was she thought she might lose her job, which was huge. So many women may miss up to a few days a week, and this also affects, the productivity of the company. So about 40% of women said they missed work from menopausal symptoms, which can be huge for a company's organization. So what did we do for Sharon? Well, again, I did a full history consultation. I also did the Wheel of Life, which you can see to the right. I also tested some hormones for her. So I checked her estradiol, progesterone, her thyroid, her FSH, her cortisol, DHEA, and some other labs to make sure, like vitamin D, vitamin B12. to make sure that she was getting enough of those vitamins and minerals. Her symptoms were severe, and she had tried non-hormonal options, but they didn't work for Sharon. So we started a low-dose bioidentical patch, an estradiol patch, which means transdermal through the skin, and we started an oral progesterone at nighttime to help with her night sweats and her hot flashes. So she had hot flashes during the day and night sweats at night. So her daily routine was just all thrown off because she had hot flashes during the day, she couldn't sleep at night, she's waking up, and she just felt like her whole world was pretty much crumbling. And once we started the bioidentical hormone therapy, she was feeling so much better. We also worked on lifestyle reset tips like Mediterranean diet, weight-bearing exercise, stress reduction, mindfulness practices, sleep hygiene. All these things are critical to have a good life so that your body and your brain and your spirit are all working together to be the new you, because you may have felt like you've lost yourself. That old you is not there anymore. How can you get back to the new you, or the you that was there before, right? We can do that. And that's with all of these things that I mentioned. So now let's go back to Sharon. So this is the before and after pictures of Sharon. So you can see she lost over 80 pounds. I mean, it's amazing. And she feels confident at work. She now is focused. She's clear. She feels like she can do whatever task is put upon her rather than feeling overwhelmed and completely like at loss. And also the stress is gone. Her stress about fear of losing her job. She now feels confident that she can succeed at her job and she'll be able to keep her job. You can see she's totally elated with her weight loss. She feels balanced with her hormones, and she's finally sleeping through the night, like 8 hours of sound sleep. What a concept, right? If any of you, if you're having problems with sleep, definitely there's things we can do to help you. So that is Sharon. So now let's meet the third patient of mine, and this is Michelle. Michelle is menopausal, age 53. She recently got divorced. Her kids just left off for college, so now she's an empty nester. She really is feeling no purpose in life, really down and depressed. She's also caring for her mother, who has dementia, and her father, who has diabetes and high blood pressure. So she is just feeling pulled in every direction, and she just doesn't feel motivated. She's having hot flashes, night sweats, and brain fog. So what did we do for Michelle? Again, we did the same things that we did for Sharon and for my first patient and Cheryl. So Sharon and Cheryl, for Michelle, lab work. We did a full history and consultation. We checked to make sure her thyroid was good. We found that her thyroid was a bit low, and this was causing to her depression and more feeling of just listlessness. So we corrected her thyroid. We also looked at her hormones, which she was completely deficient in because she was menopausal. Remember that graph that showed the decline in estrogen and progesterone? Well, she had like less than zero point 0.5 progesterone, and her estradiol was like less than 15. So it was very, very low. So I explained to Michelle about the benefits and risk and benefits of hormone therapy. And we just found out that the FDA removed the black box warning on hormone therapy, which also reassured her more about the benefits of hormones. And we started a low dose patch, you can see there. And we also started an oral progesterone. And now we also added a low dose of thyroid medication to correct the thyroid deficiency. So she had hypothyroidism. Again, lifestyle changes, very important. Exercise, diet. We also put in some journaling because she was feeling like no purpose in life. And we had to figure out like what's going to make you feel like yourself again and feeling a purpose in life, because you've got so much to give, Michelle, and we had to find it again. So we did a lifestyle reset. We talked about diet, nutrition, and also things that help with hormonal balance. We talked about going into volunteer groups, a book club, and line dancing. Find some things that are fun that you want to do. Maybe it's learn a new language or go to an art group, painting, anything that makes you feel more fun, more alive. That's what we want to we want to reintroduce that part of you back now so that you start living at the optimal that you can. So quality of life is huge during this whole transition. We also talked with Michelle about stress management, yoga, meditation. She now has a yoga studio she goes to real close to her neighborhood. She can walk there. She can go to yoga. She has friends there in yoga class. She's relaxing. She's going to travel. So one of the things she loves to do that she didn't know is she wants to travel all different parts of the world. And that's one of the things that I love to do. And I do retreats for women to go on travel expeditions to Italy, Greece, everywhere. That's really fun. So, like we talked about, the third pillar was the mindset shift. So, this is how we can change our mind and your mind to not see perimenopause or menopause as the end of your youth or like you're done, you're going to go to pasture, right? Life is over, but really as a start of freedom and reinvention. So, know that this is another chapter, but it can be a really fun, exciting chapter. It doesn't have to be depressing and just feel like you have no purpose, right? We also can normalize this experience by saying you're not crazy and you're not broken. These are real biologically driven changes. So find a physician, a person who's well voiced in menopause therapy, perimenopause, hormones, so that you can get someone to help you who actually can look at your health, look at your labs, look at your whole wheel of life, put it into a holistic type of framework, and then make the best plan for you. And also, it's important to set boundaries so that you don't take care of everybody else, but now start taking care of yourself. Self care is over all these three pillars is also self-care. So the umbrella of self-care is what these are under. So this is the season to set boundaries and protect your energy. I can't stress that enough. So what are three things you can do this week to start making life better? Well, first is understand your hormones and your biology. Go back over those slides about what is menopause, what is perimenopause, what's happening to your cycle, and then figure out what are your main symptoms that you're having. Lifestyle reset. Think about the foods you're eating. Avoid processed foods. Have more fresh fruits and vegetables. Also think about supplements that can help make your quality of life better. Exercise, weight bearing exercise, and also cardio stimulate circulation and metabolism. And the third is mindset reset. So we talked about those three pillars. The third is the mindset reset. Prioritize your sleep, stress reduction, journaling, find different support groups, and then be finding a way to rejuvenate. So this is what's going to really help you going through these phases because, as I say, you are not broken, you are evolving. And this stage can be a launch pad for your next amazing chapter. So see it as a next chapter in a life that's full of lots of fun things to do to make your life easier as well as your family's life, right? So one thing I want to invite you to do is that I want you to join my Facebook group, and this is my wellness group, and it's called the Diva group. And with that, you're going to get a Wheel of Life as well as the perimenopause tracker. So if you scan that, it's going to get you into the Diva group, and then you get those two free gifts. So pretty cool, right? So if you want to make some changes right now and start making your life better, please scan that QR code, join my Facebook Diva group, and start living your life. So with that, I'm going to answer some Q&A, some questions that have been asked from my patients that are very commonly asked questions, because some of you may have questions just listening to this webinar and say, well, I still have some questions. So help me with this, Dr. Hoppe. So first question is, am I ever going to go back to myself? I don't feel like myself anymore. I've lost it. Will I get better? The answer is yes, you will. Because once we educate, get the labs, get your history, figure out what's the best design, the best hormonal balance, the best lifestyle reset, we can get your life to be better so that you can feel like yourself. One of the things my patients say are, thank you, Dr. Hoppe. I feel like I got myself back again, which is like music to my ears because that is what I love to do. Another question is, am I going crazy? My brain, I can't remember things. Is this early dementia? No, it's not early dementia. It's perimenopause. It's the brain fog. You're not sleeping. The hormones are fluctuating. Remember, I showed you that slide. It's like a roller coaster. And then you wonder why your body's kind of feeling like, why is it doing this to me when I should feel the best I should be, right? So this is the time that we can crack this paradox and make your life so that you can sleep. Make sure that you're eating well. You can exercise. You can actually lose that unwanted weight, just like Sharon did, right? You saw how much weight she lost, 80 pounds. It was unbelievable. She was so happy. And partly it's because patients ask, why am I so tired? Well, you're so tired because you're not sleeping. You're waking up in the middle of the night, 3 o'clock, 2 o'clock, 3 o'clock, look at the clock, don't want to look at the clock, can't fall back asleep. Then you wake up saying, I don't even feel like I rested. Why am I even trying to sleep, right? We can give things like oral progesterone and sometimes progesterone cream, but depending on your symptoms, we can make your sleep way better. Also, we can add some estrogen to the equation. Also helps with your sleep so that you don't feel tired the whole time. Because when you're tired and you're not sleeping, you also get irritable. So I get that question of, who is this woman? I used to be really like mellow and calm. Now everything overwhelms me and I'm screaming at my kids. I don't want to be around my partner or my husband. And now I'm even worried about, like, are we going to stay married? So this is a very important part of life, this transition. And we need to get you to understand what's happening so that you can educate your partner, yourself, so you can get the help, the hormones, the supplements, the lifestyle changes that are going to make your life the best it's ever been. Because this chapter can be the best that it's ever been. So with that, I want to thank you for taking the time and being with me. And I hope this helped you out with all of your questions. And these are ways that you can get to me if you want to see me for a consultation. You see my phone number. I have a website called Amazing Over 40, blog posts. I'm on Instagram and Facebook. And also I have my Diva group. So I would love for you to join my Diva group because this is a really cool group of women. We do some really fun activities together, virtually, podcasts. I do Facebook Lives, and I have little contests sometimes. But it's really nice to know you're not alone, that there's other women going through these same things that you are. So having a group, and I like the Divas, because it's really an exclusive group that I give special gifts to. So it's kind of fun. All right. So thank you so much for joining me. I hope you join my Diva group and know that there is help out there. And as always, remember, stay amazing.